Hey y'all, my name is Angelica Rubio, State Representative for District 35, representing the city of Las Cruces, and this is a very, very long update. Also, excuse the water stain. It's been one of those days. So today, Governor Michelle Lujan Grisham signed a proclamation calling all of us legislators back to Santa Fe on October 1st and 2nd. And that is called a special session. For folks who don't follow this kind of stuff every single day, here's what that means. Only the governor can call for a special session under the state constitution. And she also gets to decide what those topics are going to be on the agenda. And so, for example, if I have an idea for the special session, it's likely not going to get on unless it's something that she decides will be on the call. So we just can't add things on our own. And so over the past few weeks, she and other legislative folks in leadership have been figuring out what needs urgent attention, and today they made all of that official. And also what I mean about urgent attention, y'all, is that we're going to go back to session in January. But there's things that are happening right now that can't wait until January, and this is why she's calling this special session. So I guess the big question is, why are we going back? And one of the reasons is because during the pandemic and the start of COVID, a lot of people lost their jobs or had their hours cut, and a lot of folks who lost their health insurance came from those jobs. During that time, food prices were also going up. People were scared about getting sick and not being able to afford care. And so the federal government stepped in and they gave states extra money so that folks could stay insured. They told states that they couldn't kick people off of Medicaid during the emergency. And so they did that. And then they also helped to boost food assistance so that families could keep food on the table. But now Congress and the President of the United States, they have ended these programs and they cut back the money that was helping a lot of these families stay afloat. They did that with the big budget that was passed and signed on July 4th. And so now every state, including New Mexico, is being forced to go through everyone on Medicaid to see if they still qualify. And so thousands are losing their coverage, some because they make too much money now, but a lot of times it's just because paperwork is missing or missed deadlines, things like that. So it's a lot of administrative errors. At the same time, though, food assistance that helped families and seniors get through the month is also shrinking. And here in New Mexico, where families already live paycheck to paycheck, where rural hospitals are already closing, where kids show up hungry already to school, the impact is not only happening really, really fast, but the impact is going to be felt for a lot of years if we don't step in as soon as possible. And here's the thing that many of you all may not know, because it's not something you would know if you didn't really pay attention to what's happening at the state level and the state legislature. But New Mexico has had billions of dollars just saved up in these accounts. There's a lot of accounts. I am not going to go into detail, but we just have billions. Some of the highest amounts of reserves in a lot, compared to a lot of places around the world. And we've been told for years that we need to put that money, the people's money, away for a rainy day. And well, it's raining, y'all. Families are drowning. And so I think that as we lead up to the October 1st special session, part of our work is to make sure that the people's money is put to work. So here's my call to action. Between now and October 1st, when we go up to Santa Fe, lawmakers like myself and the governor will be negotiating around how much of the people's money goes into each of the areas that she put on the agenda, which I'll go over one by one. Nothing's decided yet, and this is why it's so important, because this is where you come in. Because if we stay quiet, leadership will try to do the bare minimum and call it good enough with whatever we end up with. And that's not acceptable. We need to demand that the people's money actually work for the people, especially the people who need it the most, not just to sit in some account while families struggle. And so here's what's on the table. First, it's a really important one, and that is to help those of the folks who are losing their Medicaid. Y'all, when people lose their health insurance, there's so many consequences to that. Families start to skip checkups. Kids don't get their asthma medicine. They don't get their mental health services or keep their appointments. Folks who have chronic illnesses, they will then maybe go untreated until they turn into emergency visits that cost a lot more, not just in money, but in lives. Families will decide to cut back on food, on rent, even education, just to pay hospital bills. And I don't have to tell you all, because we have so much generational poverty here in New Mexico, but that's how poverty passes from one generation to the next, is that we have so much healthcare costs that it becomes so overwhelming. And the people's money, in my opinion, should stop this cycle before it gets worse. The second thing on the agenda, the first thing was Medicaid. The second thing now is food assistance for kids, families, and seniors. And don't get me wrong, y'all. What's on the agenda, I'm cool with it. Like, I think these are needs that we need to deal with. When it comes to SNAP and food assistance, I think it's really important for us to understand the consequences of that too, much like people who are losing their healthcare coverage. And that's when kids show up to school hungry, for example, they don't focus, they fall behind. When seniors skip meals because groceries cost too much, they get sick more often. And then when they get sick, then their care gets more expensive. And sometimes, because my parents are seniors too, they are constantly debating about whether or not they should choose food versus medicine, and that shouldn't be the case. Federal cuts to the SNAP program, school meals, for example, are getting hit really, really hard right now. And it's not that they're just getting hit hard, but it's happening so fast. And so the people's money should keep food banks from collapsing and making sure that kids and seniors aren't left out just because Congress decided to walk away. The third thing is public broadcasting support. Now, for rural New Mexico, this is a really important piece. This isn't for those of us who just listen to public radio for like classical music. In rural New Mexico, public radio and TV aren't just news. They're how people find out about wildfires, water shortages, clinic closures, or where to get help. If those systems fail, whole communities, especially those without reliable internet, they get cut off completely. And so that isolation makes emergencies worse and keeps families in the dark. And so the people's money should be used to keep those communities connected. The fourth thing is resources to the Healthcare Authority. This is the agency that runs Medicaid. With the federal unwinding, which I talked a little bit about earlier, is that right now this agency is drowning in paperwork. They need more staff. They need better systems, because right now people are getting kicked off by mistake. Families are put in limbo, and many are giving up on the system because it's just hard to navigate. The people's money should fix the system now before this problem multiplies. And finally, rural hospitals. You're going to hear doctors and lobbyists blame malpractice laws for closures because that's the story they've been pushing. But y'all, this crisis has been building for decades. Federal support for rural healthcare has shrunk significantly. Medicaid payments barely cover a lot of the costs, and there's a lot of long-term shortage of doctors and nurses who get paid really, really low. Support isn't always there, and people burn out really, really fast. I'm not going to say much more about that because I have a lot more to say, but what I want you all to know is, so that's what this session is all about right now. The decisions that we make or fail to make will shape healthcare in the state, food access, and rural communities for years and years to come. We need your voices in this. Share your stories. Tell us what it would mean to lose Medicaid, to see your local hospital close, to stand in line at the food bank because your benefits got cut. Lawmakers need to hear from you before we head into session on October 1st and 2nd. Y'all, because if we keep sitting on the people's money while families are struggling, we'll lock in harm for another generation, and our people don't deserve that. With that, y'all, be safe, take care, talk soon.